in listen-only mode.
Hello, everybody. Welcome and thank you so much for your interest in learning about our project leadership trainings. So before I introduce Alison, I'm just going to tell you a little bit about Family Voices of California. These presentations are statewide trainings on topics that affect children and youth with special healthcare needs. And our webinars are geared towards very diverse groups of which include families, and professionals, parent-to-parent resource staff, advocates, and so on. So Family Voices of California is a statewide coalition of locally based parents-run centres working to make sure that children and youth with special healthcare needs receive quality care. And as the state affiliate of National Family Voices, we are the California's federally funded Family-to-Family Health Information Centre, providing statewide support to families. So a few notes about the technology that we're using today. If you don't have a headset for your computer, you can join us by telephone by dialing into the number that you see on your attendee screen panel. And if you have any technical difficulties, please call GoToWebinar directly at the number on the screen. And owing to feedback issues, we keep everybody muted from our end, but when it comes to question time, I will try and unmute you. I'm not always successful at that, or you can type your questions into the little screen of your panel, attendee panel screen under the question box, and then I will give those questions to Alison. And feel free to type questions, ask questions throughout. Alison is actually going to take breaks periodically through her presentation to take questions, but feel free to type them in any time. So today's presentation is going to be recorded and will be posted on our Family Voices website. And after the webinar, you're going to be emailed a very short survey to evaluate today's presentation, and we would really appreciate if you take the time to give us your feedback. It really is invaluable to us. So now it's my pleasure to introduce my wonderful colleague, Alison Gray. Alison joined Family Voices as the Project Leadership Manager in April 2013, and she has a background in education and educational publishing and was drawn to this work as a result of her own experiences navigating systems and services for her son who has special healthcare needs. Alison is the California Family Advocate on the Western States Genetic Services Collaborative, quite a mouthful, but a wonderful collaborative. And she also serves on the AMCHIP Family and Youth Leadership Committee. So Alison, take it away.
Okay, you should be able to see my screen. Welcome, everybody. Thank you for joining us for today's webinar to learn more about Family Voices of California Project Leadership. We're going to focus today on just a brief background of the project, talk about the need for this training in California, talk about the project goal. I'll give a very brief description of the content of our project leadership curriculum, and we'll look at some of the key components of the project. We'll show you some of the results of our training program and what our graduates are doing with their training skills. And then we'll talk about our upcoming Training of Trainers workshop. And there will be time for questions throughout. I will stop after each section, but there will also be time at the end. So first, I'm going to just talk about the need for this training and why Family Voices of California decided to develop a parent advocacy training. There are approximately 1 million California children and youth who are considered to have special health care needs. And this may include physical, behavioral, or developmental disabilities. This graph is from kidsdata.org, which is an excellent resource if you're not familiar with it. And as the Lucia Packer Foundation for Children's Health has reported, California fares poorly in comparison with other states nationwide on many federally mandated core outcomes by the Maternal and Child Health Bureau. And I'm just going to cite a few examples because people are usually surprised by these. Nearly half of California children with special health care needs don't receive effective care coordination. We rank 46th in the nation on this core measure. More than 40% of California's children with complex health needs have a difficult time obtaining community-based services, such as finding doctors and scheduling appointments. More than 4 in 5 children with special health care needs in California do not receive care that meets federal minimum quality standards. And the last one I'll cite is that California ranks last in the nation in the percentage of children with special health care needs whose families experience shared decision-making with healthcare providers. And many of you are familiar with the systems and services that families use, and these poor rankings are not surprising given the multiple health service systems and how complex and difficult they are to navigate, even for the professionals in the field. So families of children with special health care needs, they have the significant real-world experience that can help make healthcare policies and administration more family-centered and culturally competent, but many lack the training, the experience, knowledge of systems and government, how policy decisions are made, as well as the confidence to make their voices heard. And this is why Family Voices decided to develop the Project Leadership Training Program. It's designed to implement, it was designed and implemented to address these barriers and enhance family participation in programs and policymaking statewide. Just a brief background about the project. Initially, the curriculum was developed in 2004 by Family Voices of California with a grant from the Marguerite Casey Foundation. And after that, individual chapters are presented by Family Voices council members at various conferences and at their local council member agencies. And it was in 2013 that Family Voices was awarded a grant from the Lucille Packard Foundation for Children's Health to implement a pilot training series. And now in 2017, we're in our 4th phase of funding, and we are grateful for Lucille Packard Foundation's ongoing support of this project. Our main goal is to increase the number of family members of children and youth with special health care needs who are prepared and supported to become advocates for healthcare policy and service improvements. We do this by offering a comprehensive training curriculum paired with mentoring and support that prepares families to build partnerships with professionals, take on leadership roles, and engage in public policy advocacy on behalf of all children and youth with special health care needs. We train families to have their voices heard in an effective way, whether for serving on committees, councils, other types of groups, talking to their legislators, telling their stories to the media, or and we also provide the support needed in order to do this in an effective way. I'm not going to read through the full table of contents. This shows the 7 sessions that are offered as part of the training. The training is available in both English and Spanish. It can be used as a whole series or as individual workshops. And really, the overarching theme is partnership with professionals and decision makers. We cover the history of advocacy, systems and laws that pertain to children with special health care needs and disabilities. We go over the legislative process, work on communication skills, practice telling your story in an effective way, and then also explore ways that parents can participate once they are finished with the training. These 7 sessions are designed to be dynamic and interactive, giving the participants opportunities to learn with and from each other. The participants work on an action plan throughout the 7 sessions and work on issues affecting their own families and other families of children with special health care needs. There is some homework between sessions, and it's important to note that This curriculum is adaptable to specific target populations or geographic areas. One agency adapted the curriculum to the group of parents who had children from birth to 5 years old. Another agency is adapting it to target a group of transition age youth who use California Children's Services. And others have adapted it just for their, very specifically to their local areas. We have had significant interest from out-of-state agencies, and this curriculum could also be adapted to be used with your state systems and services as well. The overall structure and staffing of the project, we have the Family Voices of California Council, which is made up of staff from Family Voices of California Council member agencies that are throughout the state. We have the project director who's housed at Support for Families in San Francisco, and that's Juno Duenas. I'm sure many people on this call know Juno. We have the project leadership manager, and that's me. And then for the local host sites, we have the trainer/mentor and then any support staff. In terms of recruitment and retention, and I generally talk about these together because they really do affect each other. Our target population are caregivers of children and youth with special health care needs, disabilities, or mental and behavioral health issues. So far in these first 4 years, we've had moms, dads, foster parents, adoptive parents, as well as grandparents take the training. Agencies who are recruiting parents reach out to really wide variety of organizations and hospitals that serve children with special health care needs, and this may include family resource centers, support groups, California Children's Services, pediatric specialty care clinics. This type of outreach we've seen success in being able to recruit a diverse group of parents in terms of race, gender, diagnoses, family structure, languages, as well as educational and socioeconomic backgrounds. When we recruit, we generally let parents know about incentives, and if your agency's able to offer incentives, they might offer food during the meetings, and the meetings do last 3 to 4 hours. We recommend 4 hours ideally, so there's enough time for breaks. So they're generally half-day sessions, but some agencies have been able to implement them in 3 hours. And if you're able, childcare is very offering childcare makes it much easier for a lot of parents to attend, and then some agencies are able to offer stipends as well to help cover with childcare costs or parking or transportation costs as well. Accommodating families' schedules is something we have found to be very important to consider when you are planning the training, and this means figuring out what schedules might work well for your target group. It's important to note how challenging it can be for parents of children with special health care needs to complete trainings, let alone a 7-session training, because they're so busy coordinating services, taking care of their kids, going to appointments. We do our best and encourage agencies to support families and be flexible, and it has been effective. And I'll give you some examples. Many host sites will send out a survey to families who are interested in taking the training to find out which schedule would work best for them. Evenings, a Saturday, weekday, afternoon. So that's the best way to find out how you can best accommodate your families. And we also encourage to allow makeup sessions. Things happen with their kids and they have to miss a session. So that's another factor to consider when you're planning your training. We have a participation agreement with families so that they fully understand what their commitment is and that they understand the schedule and the time and they know what they're getting into. We also offer a certificate of completion at the end of the training. And all of these, this recruitment and retention, we go into much more detail during the training of trainers. This is an overview for you today. A key component of project leadership is the ongoing mentoring and support that is offered. After completing the leadership training program, parents can still find it hard to put their training into practice. They might not know where to begin to find involvement opportunities or what they need to do to make their voices heard. And many without experience in advocacy, even though they've gone through the training, they still lack the confidence to put their skills into practice. So these are the types of support that we offer. There's ongoing individual mentoring, and that is not only by the host agency who's offering the trainings to the parents, but Family Voices of California also offers mentoring. I take phone calls and emails from parents to help them if they have questions. Or if they're looking to get involved in a particular agency and they're having difficulty, I might be able to connect them with the right people in their local area. Family Voices of California also offers quarterly webinars or conference calls to both graduates and trainers of project leadership. Some examples of recent quarterly webinars we've offered are an attorney from Disability Rights California on the topic of upcoming policy changes regarding developmental disability services. We had a nationally recognized parent leader who talked about the challenges and successes of her journey as a parent leader and offered tips to our graduates. We recently had a consultant from the California Children's Hospital Association present on federal health care reform efforts and talked about effective ways to express concerns and tell parent stories to their legislators on the issue of healthcare reform. We also offer an online advocacy community on Facebook. It's a private closed group just for graduates and trainers. It's a place where we exchange information, I make announcements, post articles, and graduates can share what they're doing as well. We offer 2 annual alumni meetings that are in-person meetings. One we have in Northern California and one in Southern California. And that's an opportunity to bring graduates together to meet people they've not met before, to network. We have speakers who present on current issues affecting children with special health care needs, and also usually have speakers on refreshing or reviewing skills from the training. And finally, there is the support that the participants receive from their local host site, or sometimes local host sites will refer parents to their local family resource centers if they are looking for individualized support for their personal situations with their kids. Part of our mentoring process is 2 databases that we have. One is a database of family leaders. It includes the project leadership graduates and has their areas of expertise, their interests, as well as their advocacy and leadership activities, so we are able to track what graduates are doing. And we also have a database of opportunities that lists different opportunities available at the local level, regional level, state level, and national level. And just as an example, at the local level, we have hospital advisory groups there. We have California Children's Services, family advisory groups, county advisory groups for mental health, county disability groups. At the regional level, we have State Council on Developmental Disabilities and the regional centers, what kind of ways parents can get involved there, whether it's on the board or different committees. And at the state level, we have in there California Children's Services Advisory Group. There's a Medi-Cal group at the state level as well. And an example of a national opportunity for parents that comes up frequently is the American Academy of Pediatrics, excuse me. And these databases help us match parents to opportunities. We may have news outlets contact us looking for parents with specific experiences, and we're able to contact them based on looking in the database to see, oh, these people are Medi-Cal recipients. One of them might be a good person for this reporter to talk to, as an example. I'm going to stop here and see if there are any questions about those key components. I know I went through them pretty quickly. Do we have any questions, Pip?
None that nobody's putting their hand up, but there is a couple typed in there, Alison. Going back to the mentoring and supporting the project leadership trainees, the graduates, does that also an opportunity? With the trainers, are they also supported and mentored throughout their training and after?
Yes, they are. Thank you for asking that question. So in addition to the quarterly meetings for trainers, for graduates, we do have separate quarterly conference calls for trainers. And that is an opportunity for trainers to check in about planning for their trainings, or to present questions or problems that they're having, or to get advice on something from other trainers or from me. And in addition to those quarterly conference calls, we do have an email group. And then trainers are always welcome to call me, and I do check in with them as well to see how their plans are going.
Okay, and thank you. Another question is, how do the makeup sessions work?
I've seen them work in different ways. When I was a trainer, sometimes I would meet with a parent individually, and of course you can't do all of the interactive activities, so it's much shorter, but you go over the key points from that unit with the parent. And then if there was more than one parent who missed, I would do that as a small group. Mm-hmm. So those are two different ways. I also, I know that sometimes it will be over the phone, just doing, rehashing what they missed over the phone. Now, some agencies have also set up their trainings with one weekday and one weekend session, and that allowed parents to make up their sessions that way. If they had to miss on the weekday, they could come on the weekend, or vice versa. And I think that's been the most accommodating model, but not always easy for agencies to implement that way.
Great. Do families arrange for mentoring on a set schedule or on a as needed basis?
For the local host sites, they can choose how they want to do it. I know there is one training site that is meeting monthly, so it's scheduled as a group. Otherwise, people are, reach out when they need help, and that can be by email, phone calls, or in-person meetings.
Okay. And another question, how many prospective trainers may attend the Trainer of Trainers sessions per agency or organization?
That depends. So in the request for applications, it says one representative from each agency, but it will depend on how many agencies apply. In the past, we've been able to take 2 people from the same agency, and we especially encourage it if you're sending one Spanish speaker, one person who would then implement in Spanish and one in English, because we really want it to be able to reach the Spanish-speaking populations. So that one, I have to say, we'll see how many applicants we get.
Okay, and I don't know, maybe you're going to cover this question, but do trainers need to have some kind of prior training experience and educational background like you do, or can it really be anybody?
No, so far, and this will be the 3rd time we're offering these trainings, the Training of Trainers workshop, there has been a range. Some of the participants have had many years of training experience, and others are newer to training, and this workshop is applicable to both and to all ranges. I do ask on the request for applications, so I have a sense of where people are in their training career.
Great. That's all the questions that have come through so far.
Okay, then I'm going to move on and talk a little bit about results. So far in California, we have 144 graduates from 7 different counties. These red dots on the map show where we either have graduates already or where there are trainings currently in process or soon to be starting. And in some counties, I wanted to mention, we have in this past year seen agencies partnering on implementing the trainings and sharing the resources and the cost of hosting the trainings. So, for example, in Los Angeles, the Family Resource Center there, Eastern Los Angeles Family Resource Center is partnering with Los Angeles State Council on Developmental Disabilities to implement in October. In San Bernardino, the Family Resource Center there and the Regional Center and the State Council there are working together to implement 3 different trainings in their broad area that serves San Bernardino and Riverside counties. And then we've also seen Family Resource Centers just partner with their regional center for the space and the technical assistance. So there are a lot of opportunities for partnering on this, and we've seen some really good examples of it and hope to see more of that in the coming year. In our pilot year in 2013, we had an independent evaluation done, and I like to share this slide because it really was remarkable how the parents who finished the training, there was a pre-survey and a post-survey and a follow-up survey, really expressed how their confidence had increased due to the training. They also showed significant and positive changes on measures of empowerment for accessing services for children. So even though this isn't a self-advocacy training, parents learn a lot about how the systems work, and they are better able to access services for their children. And there's a lot of peer mentoring that goes on where parents are teaching each other about the services that they are using. Excuse me. And then also participants felt much better prepared to continue to advocate for their children and for systems change. And we did a recent survey with our graduates to follow up on them, since now we have some who graduated 3.5 years ago. And we really have seen consistency with that initial pilot evaluation and the survey that we sent out. And it's very encouraging to see the newer graduates have also reported the same types of increased confidence and feeling prepared to advocate for their children as well as for change. In that independent evaluation, it showed that close to 90% of parents had either identified or joined a committee, council, or other group that represents parents of kids with disabilities or special health care needs. And we'll talk a little bit more about our recent survey, but this was very encouraging for us that first year, because getting parents of children with special health care needs on different groups and task forces and committees is one of our main goals. So often when I talk about this project, people want to know what graduates are doing, and they are doing a variety of things. One, serving on groups, as I just talked about, and I won't read through these, but you can see the range from state level to regional to local, Help Me Grow, from education to health, mental health, developmental disability. So a lot of different areas where they're serving. And in our recent survey, it showed that 75% of the graduates have either served on a group or are currently serving on a group. They meet with their local and state policymakers, and this is either at these pictures are from our Health Summit and Legislative Day, but the survey that we did showed that parents were calling, writing, visiting, or using social media to express their concerns over various statewide issues. Other parents have provided public testimony at the state, at various Senate or Assembly hearings. This one here was a hearing on California Children's Services a few years ago. And parents are also telling their stories to the media. And we've had parents, like I said earlier, sometimes media outlets contact us and we help match them to our graduates. Other parents doing it on their own and then contacting me and saying I was featured in the news, like this parent who is a graduate of ours who actually was initiated a bill for adult and youth diaper changing tables, and the bill was eventually passed and she was featured on her local news station. And we have other examples of parents writing opinion articles to their local papers and doing other variety of ways to reach out to the media to spotlight the issues that they're dealing with their children. Well, actually, before I continue, any questions about what graduates are doing with their training skills?
Alison, there's just one question about going back and thinking about the graduates who you talked about databases. This person wants to know, are these databases confidential? I mean, who are they shared with?
Oh, that's a good question. I should have mentioned that. So the databases are confidential. We are the only ones who have access to the family database. We respond to requests for parents by looking into the database, but we don't share that database directly with anybody outside of Family Voices of California. And then for the opportunities database, again, we're happy to share the information and we want people to know what opportunities are out there, but it's not something that's open for public use. But if an agency or a host site agency said, hey, I have a parent who's interested in being part of a council or a committee on a specific issue, we can try to help match them by using our database.
Okay, and one more question. Do you teach participants a refresher of how state and national legislation work, like how a bill becomes a law?
Yes, that's in the chapter. I forget which chapter it is off the top of my head, but there is a chapter dedicated to how a bill becomes a law and how the legislative process works and how the budget process works in California as well.
That's all the questions for now.
Okay, I'm going to move on. Some of the lessons that we have learned in these 4 years are the importance of ongoing curriculum revision. The curriculum continues to evolve based on participant input, as well as any changes in healthcare systems or new legislation. I already mentioned the importance of flexible scheduling and childcare and stipends. Though having said that, we do have host sites that are able to successfully implement and retain participants without offering, stipends or offering childcare. But it does help for a lot of families who wouldn't otherwise be able to do the training. The mentoring and support that I talked about is key, we feel, to what happens after the training. We don't just train parents and then say, okay, go ahead, get out there, advocate. They need the ongoing support. That also helps build our statewide network with this ongoing support and connection between parents. And then another really piece of part of the training and the post-training that we have learned is the need for multiple types of communication. Some parents don't use email. Some trainers communicate with their parents by text. Some use email. Some rely really on the in-person time. And we sometimes it's a phone call that has to be made, or we do send mailings to those who don't use email. And then, of course, we have our Facebook group. But making sure all participants are included in the communication and the mentoring and the support that happens afterwards and during the training is really important. And then, of course, there's the ongoing effort of Family Voices to educate agencies and organizations about the importance of family participation and why they should be including families in decision-making and advisory roles. Probably many of you have been waiting and wondering, well, how much does this training cost and how does it work? Who pays for it, etc. So we are funded by, this project is funded by the Lucille Packard Foundation for Children's Health, and that funds the central coordinating efforts of the project, and that includes the training of trainers, the mentoring, the ongoing support, the alumni events, and all the technical assistance that we offer. But local agencies who implement the training after they go through the training of trainers are responsible for the cost of the training. The training is free to parents. So it's the agency that comes up with the cost for materials, and it has varied widely from agency to agency. It depends. Are you going to offer stipends? And if so, how much? Can your agency offer food? Can you offer childcare? Do you have to rent a space, or does your agency have a conference room available? Do you only need to cover the cost of materials? So there's a really wide range, and we go into detail on this issue during the training of trainers. We've seen here in San Francisco at Support for Families, this training was just implemented as part of an existing parent mentor training program, so it was no additional cost to the agency. Okay. And again, so Lucille Packard Foundation for Children's Health and Family Voices, we don't provide the training costs, but we do provide support, and the being part of our network is part of that ongoing support.
Oh, Alison?
Yes.
There's a question come through regarding the budget. Do you, does Family Voices of California offer ideas on where agencies can go, outside funding for training?
Absolutely. Yes. As part of the training of trainers, there's a whole section on looking at how your agency may budget for this, and also potential funding resources, as well as materials on, using, we give language for what you could write into a proposal if you're writing a proposal. So we offer all of that as part of the training of trainers. Okay, and now I'm going to talk about the training of trainers and then open it up for more questions. So first of all, I think everybody on this call probably is on the webinar because they received the request for applications information. And I want to clarify who the Training of Trainers workshop is for. And I'll just reiterate what the request for application document says. Now, this is for agencies serving children in special health care needs or disabilities, could also be mental and behavioral health, representatives, so they're staff members who would come to the training of trainers and then go back and be able to implement this training in their local areas. As I mentioned before, the types of agencies who've been to the training of trainers before have included trainers or staff from family resource centers, from regional centers, from state council, from California Children's Services, and other community organizations. Some of the things that we do during the training is 2 days, so we can't learn every detail about the content in 2 days, but we do want participants to leave with a general understanding of the curriculum content. We do an overview of the content, basically, and we go through each chapter. Participants learn best practices for the components that we looked at earlier in this webinar: recruitment and retention, facilitation of the curriculum, the mentoring and support piece, as well as any required administration and reporting. As I just mentioned, we do explore budgeting and funding options for local agencies, and each representative develops an action plan for training implementation. So they start looking at, well, when might I do this? How am I going to get the resources I need? Who will I recruit, etc. And that is worked on throughout the 2-day workshop. There is, here's the timeline for the training of trainers, and this is also in the request for applications. We started sending out the announcement on July 19th. We're having this webinar today. There will be 2 follow-up conference calls, so for agencies who are watching this webinar later, the recorded version, and have more questions, or if any of you have follow-up questions, you're welcome to join either of these conference calls coming up in August, one on the 10th, one on the 23rd. The call-in information is also provided in the request for applications document. The deadline for applications is Friday, September 1st. We'll look at all of the applications and get back to people by September 11th. The Northern California training is on the 11th and 12th. As soon as we know who is accepted into the program, we will send you information on where to stay in the area, all kinds of logistical information. We'll get that to you. And then in Los Angeles, it's the 29th and 30th, and that will be at the California Endowment Conference Center. And finally, for those who do participate, part of the commitment is to implement the training in your local area. And we're asking that the training be implemented by the end of our grant cycle, which is October 2018. And we have seen that really a full year gives agencies plenty of time to complete it, or at least to have started it, depending on how you structure. Because some agencies offer the 7 sessions weekly and do it as an intensive training, whereas others offer it on a monthly basis. So it just depends on how your training is structured, and there is flexibility around that. Finally, we offer a $500 stipend to cover the cost of attending the training. So we don't pay for your hotel and travel, but we do offer the stipend to help cover those costs. And I'm going to allow for questions about the training of trainers.
Okay. Can you hear me, Alison?
Yes, I can.
Okay. There's a question. Is there an agreement of how many trainings the alumni agency will provide to their community?
There is not a requirement for how many, though we have seen ones that started implementing 2 years ago, they're repeating the training in the following year. So a lot of the agencies who are interested in doing this are looking at ways that they can make this a sustainable project for their agency and offer this training ongoing, but it's not a requirement to offer it 2 times, 3 times. We just want, like to see it offered once if you're going to make the commitment.
Okay. And another question is I think you covered this, but I'm not sure. Is the trainer of trainers only for staff members of agencies?
Oh, good question. We have seen this come up before, and last time we did have a board member of one agency who attended the training of trainers, and she is going to be one of the key facilitators, and that's fine. So, it would depend on a case-by-case basis. We would have to see what the situation is.
Okay. I don't see any other questions coming in. Okay. Is there a limit of agency trainees, or an age limit?
No. We don't have an age limit.
You probably don't take 3-year-olds, though.
Well, probably not.
After completing the trainer's training, will there be a certificate of completion given to validate the training?
Yes. We do offer a certificate of completion, and in fact, really, my goal is to facilitate the training of trainers in the same way that I would facilitate the actual project leadership training. And so we do use a lot of the same incentives, the stipend and the gift, the certificate of completion. We serve lunch, we serve morning refreshments. So yes, all of that is offered as part of it.
Okay.
Any other questions? Okay, so I'm going to finish up with these 4 alumni testimonies. I'm not going to read through them. I'll let you look at them. But really just want to mention that based on the surveys that participants complete at the end of the training, as well as this follow-up survey that we did just recently, parents love this training. They get a lot out of it in terms of the content and all of the information around systems and legislation and how to advocate, but they also really love the parent network that they become a part of as a result of being in the training. The trainers who have done this generally have had really great feedback about the training and what it's brought to their agency. So both, all 3 of the families, the trainers, and the agencies become part of this growing network of statewide family leaders. And we've seen a lot of success over the last few years, and we hope to continue on the same trajectory.
Well, Alison, actually, Tammy has one more question. Are you ever asked how this training compares or is different from the partners in policymaking training?
That is a great question, Tammy. So I do go into detail about this during the training of trainers, but Family Voices of California did work a little bit with partners in policy when they were developing this curriculum, and there is part of the curriculum is based on partners in policymaking, but it includes information beyond developmental disabilities, and then it has the focus on local issues as well. So there is some overlap, and we've had a few people attend the training of trainers who also attended partners in policymaking, and they definitely remarked on some of the similarities, but they also remarked on how, it's a more extensive curriculum than, I don't know if that's the right way, but it just goes a little bit more into, as I mentioned, local issues, more into health issues, and goes beyond some of the issues offered in the Partners in Policy.
Well, thank you, Alison. Thank you very much. And I'm
going to mention one more thing.
Oh, okay.
Sorry, there is a report that we wrote for the foundation. It's on their website. It was written after our second phase of funding, so it doesn't include the training of trainers component, but it gives a really great overview of the project if you have questions about it and you want to be able to just read it on your own. But I do encourage you to attend the conference calls or get in touch with me directly. I'm happy to talk to you on the phone or send me an email. My information's here, and it's also on the request for applications document.
Wonderful. And just a quick reminder for everybody who's attending the webinar to take just a couple of minutes to complete the survey that you're going to be emailed very soon. Thank you, Alison. Thanks everybody for joining us today. Have a wonderful day. Bye-bye.
Thank you. Bye.